I'd like you to watch this video about ganglion surgery because I'd like you to be fully informed about ganglion surgery before we go ahead with the full consent process for this procedure. Ganglion surgery is a very successful operation if we have to go ahead and perform it. Often ganglions can disappear on their own. Sometimes we can remove a ganglion by aspirating it in the clinic, but having decided to go ahead with the surgery, the general success rates are about 80%. The 20% who aren't happy with the outcome will be unhappy because either the ganglion has recurred, which is the largest group, or a small proportion of patients will have an infection or some stiffness in the wrist following the removal of the ganglion. It's important to understand that recurrence in any surgeon's hands is quite high at around 20%, and before going ahead with the surgery you need to understand that that's quite a possibility, and that over the course of 1 or 5 years after the surgery you'll be left with a scar and have a recurrent ganglion, which of course we can then deal with later if that becomes an issue. Provided there is no infection after the surgery and that the ganglion doesn't recur, generally the outcome is fairly straightforward. There are other minor risks such as nerve injury, some altered sensation around the scar, some tendon tethering or some stiffness, but they're very uncommon. When you arrive in the hospital to come in to have your ganglion surgery, you'll either be having a local or a general anaesthetic. If you're having a local anaesthetic for ganglion surgery, we'll be infiltrating local anaesthetic around your ganglion, and when the area has gone completely numb, we'll be able to go ahead with the surgery. You'll need a tourniquet on your arm for about 15 minutes while we do the procedure, and we'll prepare your arm with antiseptic and put surgical drapes to cover your arm. And you may or may not wish to watch the procedure or see parts of the operation during the operation. We can screen to make sure that you can't see the operation if you prefer not to watch. We'll chat during the procedure, and you can let us know if you do feel any discomfort, in which case we'll top up your anaesthesia if necessary. If you have a general anaesthetic for your ganglion surgery, and about 50% of patients choose to have that, you'll obviously be asleep while we do the surgery, and when you wake up after the operation, you'll have a bulky bandage around your wrist, and we'll talk about the exercises. We would like you to have an escort even for this fairly minor surgery. Many patients might think that this is a very minor operation, but following a general anaesthetic, the general guidelines are that you should have an escort to take you home just in case you feel a little faint or sick on the way home. When the operation is done, we'll close the skin usually with a dissolving suture, and then put a light sticky dressing, and I often use some steri strips on the wound to make the wound heal nicely, and a woolen crepe bandage, which is usually like a tennis sweatband. It doesn't include the thumb and the fingers, and then you can take all of that off yourself after the surgery at around 48 hours and wash the wound in normal soap and water from 72 hours. With a dissolving stitch in place, which is what I usually use, you don't need to worry about keeping the wound dry. However, if you do wash it before 72 hours, you'll find that it still bleeds a little bit, and it's best to leave it till about 72 hours in order to let the wound dry. Following this, usually the wound can be left open and you can return to work with the wound exposed to the air if necessary. It's important that you keep your hand elevated in order to reduce the swelling, and I'd like you to work straight away on finger exercises and thumb exercises, as you can see in my finger and thumb exercises videos on the same website. I'd also like to run through the wrist exercises on that to make sure you get no stiffness in your hand or wrist. When the swelling starts to settle, you'll start to feel the wrist movement start to return, and you can return to normal function, and I'll be seeing you in the clinic at 2 weeks to check your progress and make sure that the ganglion hasn't come back, that you haven't had an infection, that you're moving the wrist and the fingers nicely, and that the swelling's all settled, and that you haven't got a nerve injury. Following ganglion surgery, most patients return to work within 48, 72 hours, that sort of thing. So often with a late week operation, say a Thursday or Friday, they'd go back to work on a Monday. For heavier work, such as carpentry or using a drill or a hammer, patients would return to work at maybe 2 or 3 weeks after ganglion surgery. If you're worried about anything following your ganglion surgery, I'd like you to call my secretary or contact the hospital where the operation was performed, and at any time they will put you in touch with me, and I'll be able to either reassure you or see you urgently in the clinic if there are any problems.